I'm Dr. Yazan Aljabery. I just introduced and I stood here last year talking about a vision, about how AI and innovation could transform healthcare. I spoke about 3D printing, wearables, remote patient monitoring, imaging, ideas, possibilities, and opportunities. If you could go back, please. If you go a slide back. Yes. Well, today, I'm glad to share with you that part of that vision has already turned into a reality. We are already saving patients' lives with technology, and I'm going to be sharing with you a few real-life scenarios that we have saved and were able to save with the use of that technology recently. But first of all, let me take you on a trip of a cardiac surgery patient. What does he go through and what are the milestones? So if we see here, at the top there's QR codes. These QR codes are for you to scan, and they are a film or a short movie that we have made that highlights every step of a cardiac surgery patient's journey and his stay and what he would expect. We're distributing this to the patients and their families preoperatively to prepare them for the journey that he's going through. To sum it up, patients are usually admitted, consented, and prepared for the surgery that takes place on day 0. After the surgery, the patient is transferred to the ICU, where he's stabilized, extubated, and usually stays there for less than 24 hours. From the ICU, the patient is usually shifted to the normal ward on the next day, where he stays 2 to 5 days. Now, the discharge is usually planned on day 5 to 6. And that's usually the most challenging part for the inpatient physicians, because we have to convince the patient and their families after this long trip and this difficult surgery that they are fit enough to go back home and they are safe enough to be cared at home. After that, we schedule 2 follow-ups, one at day 14 and one at day 30 post-operative. Now, for decades, the post-operative phase, post-discharge phase, the 30 days, has been a black box. Patients are educated, they are sent back with instructions, but unfortunately, complications tend to happen, especially in the first 30 days. Although they have the instructions and we have a very well dedicated education team, the complications tend to happen silently, and the early signs are usually missed. And this escalates into emergencies, and that's usually the first time we see the patients post-operative. Now, fortunately, technology is changing the narrative. At Cleveland Clinic Abu Dhabi, and together with M42, we have a groundbreaking program, a remote patient monitoring, now only for cardiac patients, using AI-powered wearables. These wearables are small, very light, and are worn on the chest. They stick to the chest outside, they're water resistant, and they're very easy to use. Patients are educated on the day of discharge, and they're sent back home with that small device that's directly connected to their phone, from their phone to the cloud, and directly to our command center. We have a command center led by our M42 nurses, very dedicated and well-trained nurses that monitor and watch the patients 24/7. What do we monitor? It monitors a lot of cursors, but we focus mainly on heart rate, respiratory rate, skin temperature, the step count to make sure that they're active enough, sleep patterns, and even the angle of inclination during sleep. And believe me, the angle of inclination is a very specific and important factor in heart failure patients. When we note any change in the trends, and you can imagine the massive data sets that we get, it's analyzed by the AI, the thresholds are set by us, and we have a certain escalation pathway when the trends are met. As soon as something happens, the M42 nurses get alerted, and they follow the escalation pathway, starting by calling the patient at home and checking on the patient. In the past few months, we have more than 30 patients, but allow me today to introduce 3 cases that are able to demonstrate the life-saving capabilities of this technology. And the first one I'm going to share with you is a 60-year-old female patient who came for a normal mitral valve repair surgery, went without any problems. The stay was completely without any complications, and the patient was discharged on day 5. 2 days later, our nurses get alerted by a sudden rise in their heart rate, which went from 90 to 140 in a few hours. They call the patient, they check on her, she notices nothing. Asymptomatic, she's laying on her couch, she doesn't even feel palpitations or dizziness, completely nothing. So we asked her to take her pills, one of which is a beta blocker that helps bring the heart rate down, and we scheduled her for an early follow-up in our clinic. Until that time, we have noted multiple episodes of that irregular, fast heartbeat. And when the patient comes to our clinic, we have diagnosed her with atrial fibrillation. Atrial fibrillation, for those that don't know, is full of risks and is almost a life-threatening situation, given that with atrial fibrillation, people tend to form clots inside the heart. These clots could easily embolize into the head and cause a stroke. And unfortunately, that's usually their first presentation otherwise. The patients come to the clinic or come to the emergency department with a stroke as a first presentation. And when we follow up on them, we find that the patients have an atrial fibrillation, and that was the causative agent. We were able to diagnose it at a very early stage. We were able to manage it only with medication, and there was no need for any electrical cardioversion. And we sent the patient back home on the same day with blood thinners, and the patient is doing perfectly fine thanks to that early detection of atrial fibrillation. Our next patient is a very young 31-year-old male patient who also came with a congenital anomaly and required a mitral valve repair. The patient went through the surgery and the post-operative course without any significant problems, was sent back home, only to discover that 10 days later, he starts having very slow rise in his trends. His heart rate, respiratory rate, and his activity level is going down. So we give the patient a call to check up on him, and he says there is nothing different, he feels good, but he only noticed that his stool color has become more blackish. His stool has turned black, and that's something he just noticed, otherwise nothing. So for us, we know that black stool is an alarming symptom. We asked him to come to the ED and give out a stool sample for us to find that it was positive for bleeding. The patient was urgently sent for an endoscopy, and he was found to have an actively bleeding gastric ulcer. That's not a common complication post-operative, but thanks to this technology, we were able to detect it at a very early stage, which could have easily developed into a hypovolemic shock, and the patient could have came to us in a very bad situation. Our last patient here is a male patient, and that's a very common scenario that we see. 59-year-old male patient came for a very usual coronary artery bypass grafting surgery. Everything went fine. He was sent back home. Only after a few days, we were able to see also a rising trend in his heart rate, in his respiratory rate, but also in his skin temperature. We called him at home, and he noticed shortness of breath and productive cough. We asked him to come to our clinic. We did our examination, and we did a chest X-ray, which revealed a very early developing pneumonia. For him, it was at a very early stage, so we only dealt with that with antibiotics and sent the patient home at the exact same day, preventing him from a readmission that was almost inevitable. Go back, please. So looking at these cases, I would say in just a few months, we were able to enroll more than 30 patients. And these are just 3 examples of the life-threatening situations that we were able to save. And we are looking forward to continue monitoring those patients and detect more and more complications at a very early stage. The transformation is not just preventing the complications, but it is also a very big step for the patients and their family. It's providing them with a huge security feeling. And the struggle that we used to have on the day of discharge and convincing the patients that they are safe to go back home has become a very easier conversation now, telling them that they're going to go home, but we're going to keep our eye on them and we're going to follow up, make sure that we are going to detect any sudden changes even before they see it. One of the patients has put it nicely together, and he told us it feels like we're having a guardian angel who's looking after us day by day, and a caring team that will see things even before we detect it and see it. And that's just the beginning. We are willing to expand our program to go into other specialties as well. We have started with cardiac patients, but I can see a very big potential for this technology to evolve and include so many other patients. Any moderate to high risk patient could benefit from it, and I could see neurology and neurosurgery as our next candidates. And we will be able to also include other wearables. And for those that know me, I am a big fan of wearables. I love them, and I always try them on myself first. I like to try them so that I can explain them better for the patients and to have confidence and know the limitations of these devices. I have tried the continuous glucose monitoring, the smartwatches, the smart rings, and even the chest device, the button that we use in our patients now. And I'm currently trialing two very exciting devices, one of which is a smartwatch, not this one, but another smartwatch, that can continuously monitor blood pressure. And for those that know it, blood pressure monitoring until this day is a huge challenge to monitor. When we suspect that for early diagnosis, or we want to know the effect of drugs on that patient, we send them home with a 24-hour monitor surveillance, which is extremely annoying. It keeps inflating every hour, and the patients usually end up taking it at night, and we end up with a very gap in our device. Well, this new watch promises, at least from the trials, that it has a 95% accuracy of blood pressure measurements, and you need to calibrate it only once a week. I'm currently using it, and I can tell you that the readings have been extremely dependable until now. And this device is also FDA approved to detect and diagnose sleep apnea, which is otherwise also a very difficult symptom to diagnose. The other device that is very promising, and it's already entering the market, is smart textiles. Imagine wearing socks, underwears, or even t-shirts that have monitors that can detect every single vital that you can think of, from your hydration level to your electrolyte level, and even writing a 12-lead ECG when wanted. So let's picture a patient sitting on their couch at home, wearing that t-shirt, and then he feels sudden chest pain. He just goes into his app, writes a 12-lead ECG. It detects that he's having an early heart attack, myocardial infarction. It alarms the emergency team, and they send an ambulance right to their home to pick them up and bring them for an early intervention. For us, this has been a huge challenge, knowing that the first 2 hours post myocardial infarction or post an event is what we call a golden window. And if we miss that, patients usually come up with very serious complications. And this is only one of probably hundreds of devices that are out in the market now, and just require that clinical correlation, someone to adopt it and actually apply it on the ground. Not just promises and trials, no, actually apply it on the ground and see what the need is and what the limitations are. Knowing that this is just the beginning, I would also like to emphasize on a very important point. That technology is just as important as the teams that work on it. And at the heart of this technology and at the heart of this innovation, we can't say that technology saves life on its own. It's also the caring team empowered by this technology that is going to be able to save those lives. and going to be empowered in the future. That's why I would call upon all of you to embrace these new technologies, get on top of it, and let's build a better future for us and our children in the very coming future that we live in now. Thank you. I open up the floor for any questions, if anybody has anything to say.
Thank you so much for your wonderful presentation. You are a cardiac surgeon, I'm a cardiologist. I practice in the UK and I've been there. So now my question to you is, you mentioned about 12-lead ECG from Wearables. I don't think the strips come out really readable. So how do you look into that? Because we have tried to see that, but it's not yet there.
100%, I agree with that, especially if you are not at rest. So the first thing we ask the patients, now most of the devices that are out in the market, they have a 3-lead ECG. And those 3-lead ECGs only function when the patient is at rest. So when he's moving, you usually have lots of artifacts that are that you cannot depend on the diagnosis. Using these textiles though, they have a built-in 12-lead ECG that almost sticks to the skin, and they have very credible. But you don't feel it, and these garments are, it's a little bit, it sounds too futuristic maybe. I've seen the garments and they're crazy. You don't see these leads, you don't see nothing, and they are actually machine motionable. And they stick to the skin, and they can write a very dependent 12-lead ECG that I tried on myself. But again, the condition is it has to be at rest. You cannot walk and write a 12-lead ECG at the same time. Yes. Of course, you're worried, you're sitting there on the couch, but you start sweating. So instead of just jumping and running into your ambulance or calling an ambulance and wasting time, this helps in diagnosing it and writing a 12-lead ECG and immediately sending it to the emergency teams as well.
There would be a better predictor for wearables if they can determine from the bloodstream your cardiac troponin level or something like that. That would be a much more realistic marker. So
that way, we're going to move into the more invasive part. Wearables, the most significant thing about wearables is that they are non-invasive. You can wear them, you can take them off, there's no blood, there's no needles, there's no needle sticks, and that makes them more appealing to the patients. If the patients know that they have to stick themselves with the needle and take the blood and do a troponin test, that's usually something that they will go away from. I heard about some new strips, they're almost like tattoos, that have micro needles that can measure your electrolytes. For troponins, it's still, I think, a very early stage, and I'm not sure, because for troponins, you have to access directly the bloodstream and not take them from capillaries and from skin vessels.
Is there anybody else here in the audience? Sorry, I'm taking my moderator's prerogative because we've got 2 minutes on the clock. And I love this enthusiasm, but we're going to continue off stage. Anybody else for a question? If we can open up, fantastic. Our gentleman from day one, please introduce yourself. Only got a minute and a half, so very quick. Thank you.
Yes, thank you, moderator, for allowing me. Respected doctor, yes, I do agree that the way in cardiac monitoring especially I just want that still there's a trust deficit when it comes to remote monitoring.
Yes.
What is your recommendation then?
So again, what's the deficiency?
Trust deficit is
Trust.
there. Yeah. Because when it comes to remote monitoring. Yeah.
Well, the trust, I'll tell you, our patients, especially after a big cardiac surgery, trust is not an issue. They are desperate for anything that can help them go back home and sleep well. So they are desperate for any modality that we can offer them so we can keep an eye on them and actually detect those complications and subclinical deterioration even before it happens. On the other hand, if it's just in the clinic and we need to address that, we'll have to come up with a real need what the patient lacks and what the patient is looking for. So it's always a give and take thing. I'll tell you, the smartwatches has been a very big thing, especially in diagnosing atrial fibrillation. We have patients already coming to our clinic telling us that it's alarming with atrial fibrillation. Is it something true or not? So it is something that the people are more open to, but it still needs a lot of work and a lot of campaigns and awareness.
Fantastic.
Thank you very much. Thank you very much.
We've got time for possibly one more question. Okay, if we don't have another question, then I may say to Dr. Yazan, what would be your parting comment here on the M42 main stage at Arab Health? What would be your call to action here?
Well, my call here at Arab Health, I guess it's more for the physicians and caregivers that we should be open to the technology and embrace it. And we have to be on top of it. We can't wait for the technology to come and overshadow us. We have to be part of this. It is not the future. We are living in those times now. And it's either we are with it or we're going to lose the battle.
I think that's a very empowering message to end on. A big round of applause to Dr. Yazan for taking the time out of his schedule to speak to us today. And I can vouch that he is a very approachable gentleman, so please do approach him off stage. And if anybody else has a question for him as well, I may just ask our photographer to quickly get a picture of us, because this is always a wonderful time, and with our mics.
With the mics.
Co-hosts. And one more request, Aya, please come on stage. Don't be shy, come on. One of our lovely session organizers. Maybe if you want to be on the other side of Dr. Yazan, thank you for organizing this. Another big round of applause.